Hello everyone and welcome back. This is part 2 of the chapter 3 lecture. In the first section we focused on behavioral assessment, and now we are going to continue the discussion by talking about how to define target behaviors. So we will be discussing selecting and defining target behavior. So how do we select target behaviors? Typically, when we are conducting a behavioral assessment, as I mentioned, there are different types of behaviors that we can focus on. We have our adaptive behaviors, we have our maladaptive behaviors, and it can be very tricky to determine, which behaviors out of all of the list, behaviors, maybe you have a list of 20, 30 behaviors that you would like to target. How do I know which ones to prioritize? And this will be dependent on many different things, but there is one in particular that we should be focusing on, and you've heard me say this term throughout this course, and you've also heard it in your previous course as well. So it all boils down to identifying the behaviors that are the most socially significant behaviors. As I mentioned, the field of applied behavior analysis is a field in which we focus on improving behaviors that are socially significant. So a socially significant behavior is a behavior that improves a person's quality of life. It is a behavior that produces short-term and long-term effects for an individual. So it doesn't just improve their life in the short term, like in the now, it also will produce lasting effects for the future, so that they can, be more independent in the future. They'll be able to sustain social interactions in the future, communicate effectively, maybe potentially work independently at their workplace. Whatever it might be that you've worked on with them, we want these skills to produce lasting changes. That is one way that a behavior would be considered a socially significant behavior. Additionally, it would improve their quality of life, which, what does that mean? That sounds so subjective, but improving the person's quality of life can mean something as simple as broadening their communication, or it can also mean, giving them the possibility to access new reinforcers, to engage with new individuals, it enriches their environment. Okay, so we want to prioritize behaviors that will meet these 3 criteria, that produce short and long-term effects, that have long-lasting effects, and that will improve a person's quality of life. Now, this topic of socially significant behavior is such an extensive topic, okay? We will not be focusing on the social significance of behavior in this particular course, but there are ways to basically decide in a systematic way which behaviors we want to prioritize. And you will learn how to do this, but it will be in a future course. Within this lecture, I'm simply going to introduce a topic to you guys of socially significant behaviors. You should be aware that when you are beginning services with the client, there will be a myriad of potential behaviors to work on, but we won't be working on all of them at a given moment. You will choose the main ones to focus on based off of social significance, and then eventually, once some behaviors are mastered or you see progress with certain behaviors, then you can go ahead and add, some of those other behaviors of concern in. But for today's lecture, we'll be focusing more on defining target behavior. Defining target behavior is one of those skills that can be very challenging for individuals. And I want to make sure that you guys have a solid grasp on how to define target behaviors before you get into a more advanced skill like determining which behaviors are more socially significant. You will learn that, but it will come up in a future course. Okay, so before we get started with our discussion on defining target behavior, I want to do a refresher of what is behavior. Okay, so if you recall from your course in your introductory course in the experimental analysis of behavior, you should have learned about what behavior is. And behavior is anything that an organism says or does. It refers to any interaction between the organism and its environment that results in some measurable change in at least one aspect of the environment. So what this means is that behavior is an action. It has to produce some measurable change. Behavior is not a lack of action. And I'm emphasizing this because there are certain terms that people use in the field of behavior analysis that don't necessarily classify as behavior. And we have to make sure that as behavior analysts, we do our best to remain conceptually systematic, meaning that we are remaining true to our language as behavior analysts, that we are continuing to use our technical jargon and not resorting to mentalistic terms or unobservable terms, etc. Okay, so behavior is everything that an organism does or says, and you should know, and I want to emphasize that it is an action, okay? Meaning it typically will be like a verb. You know, when we start defining the behavior, you'll get what I mean, but it's typically those words that end in I and G. Okay, and it's not a lack of action. So an example, I have an example here for you all. It's a little bit difficult to see actually. I apologize about that. But the difference between non-compliance versus saying no. So non-compliance is a term that we hear often in our field, or we just hear often in general, of people saying, no, you know, my child is being non-compliant. He's not listening to me. Well, what is non-compliance? Would non-compliance classify as a behavior? And, you know, in the realm of psychology, that might be an okay term to use. But in behavior analysis, it's really not an action. When we use the term non-compliance, you're saying no behavior, basically. Like it's in the word, it's no, non, right? Like meaning no, and then compliance. So the person is not complying. So you're referring to a lack of an action, and that would not classify or meet the definition for what a behavior is. So what we should do when we are trying to define behavior as behavior analysts, we want to try to rephrase these I guess terms, and try to use more observable terms that we can measure directly. So something like saying no would be a good replacement for a term like non-compliance. So instead of referring to a behavior as non-compliance, we could refer to it as simply saying no, and we could define what that means, or we could refer to it as task refusal, for example, rather than non-compliance, because task refusal specifies an action. It specifies a behavior that a person engages in, whereas non-compliance, you're basically talking about the lack of a behavior, the lack of an action, and that does not classify or meet the definition for behavior. So just this is one consideration. There are many considerations when we are defining behavior. This is one of those things that you should work to keep in mind. So again, I want to continue to review some things that you've learned previously, because I think it's very important when defining target behaviors. So I want to ask you guys, are thoughts behavior? And this is something that, again, you covered in EAB 3002. But I don't want to assume that you remember that information. You know, maybe you do. But it's possible, you know, you may have taken the course prior to last semester, maybe 2 semesters ago, and so a refresher could be beneficial. So take a moment to answer this question. Are thoughts behavior? Okay. And the answer to that question is that from the radical behaviorist perspective, thoughts are a form of behavior, because the radical behaviorist accepts private events such as thoughts or feelings or sensations as legitimate areas of study. Whereas a methodological behaviorist only focuses on those actions that are observable outside of the human body, right? That we can observe and that we can measure. Well, thoughts are a form of behavior that are classified as private events. They're difficult to quantify, right? They're not observable to us. They are behaviors that we engage in privately. And so it makes measurement very challenging. So from the radical behaviorist perspective, yes, thoughts are a form of behavior. It's just behavior that we as behavior analysts should work to study, to analyze and to find ways to modify. So there's an example in the textbook that you guys use in EAB 3002, the Pearson-Cheney textbook. I think it's changed. The name is, the authors are now Rasmussen, Pierce, Cheney, and there's one other one. But anyways, in that textbook, they present an excellent example of how thoughts are a form of behavior. And they basically give an example of a chess player that can think of moving different chess pieces and enact the specific contingencies that he's going to encounter within each move. So basically, the chess player in his head, with his thoughts, he will pretend to move upon and think about the specific consequence that will follow. And although he's not moving the pawn physically, he is, the consequences that he is thinking about in his brain are modifying his behavior. They are changing how he will proceed in the future. And so that's why thoughts are considered a form of behavior, because we can enact those specific consequences that may occur, and that does modify our future frequency of behavior. Okay, so yes, they do pose specific measurement challenges, but we do acknowledge thoughts as behavior. However, that being said, we tend to focus on behaviors that we can measure and objectively observe. So within this course, we're focusing on those observable behaviors. We won't be, trying to define thoughts. There are other realms of behavior analysis or other branches of behavior analysis that have, I think, done a phenomenal job of creating interventions and assessments for, thoughts as behavior. But that's not my area of expertise, and that's not what we're going to be focusing on in this course. However, it's important for you to know that thoughts are a form of behavior. So do we change thoughts as behavior analysts, or do we try to change thoughts as behavior analysts? And as I mentioned, we do not. No. We don't change thoughts directly, but we do try to address the observable behaviors that are related to those maybe thoughts. Okay, I cannot get inside of a person's head to see what they are thinking. However, I can see maybe the behaviors that they are engaging in their physical environment. So if I present work to a client of mine and I see that they are trying to get out of the table, that they are maybe crying, or maybe potentially engaging in a tantrum, I can observe those behaviors. There are likely thoughts going on in their head, right? That they might be saying, I don't want to do this. This is not something that I'm interested in doing. It's so difficult for me, X, Y, and Z. They might be saying many things in their head. Well, I can teach specific behaviors, specific self-management techniques or de-escalation techniques that will maybe indirectly improve a person's thoughts, but I'm not going to target the thoughts directly myself. And so one example of a way that we could target other behaviors that will improve thoughts would be to teach a person to request a break if they're not interested in completing a task, or teaching them to engage in deep breathing, and that might indirectly improve those thoughts. There are different applications of behavior analysis that focus on improving thoughts. Those are relational frame theory, or RFT, and then we also have acceptance and commitment therapy, or ACT. To implement these specific assessments and interventions that are available through these areas of behavior analysis, you should gain training. You should be skilled in these particular areas. And so if you're not, then you need to make sure that you are, requesting supervision from somebody that is trained or skilled in this particular area, or that you're attending continuing education events to gain training in those areas. As I mentioned before, we need to make sure we're practicing within our scope of competence. Okay, so now we are on our first ASR. So how do radical behaviorists view thoughts? We discussed it earlier, but I just want to make sure that you can recall this information, and this is like basic information that we should know as behavior analysts. So please take a moment to respond. Now let's discuss feelings. Are feelings a form of behavior? And the answer to that question is no, feelings are not a form of behavior. because feelings instead are a byproduct of behavior or of our experiences in our environment. A behavior, as I mentioned earlier, is something that's observable, is something that's measurable, and it's typically like an action such as speaking, walking, writing, jumping, moving. Those are behaviors. Whereas a byproduct of behavior is some internal experience that resulted from something that occurred in your environment, some behavior that you may have engaged in. So it's some interaction between the environment and the organism. Okay. Feelings do not cause behavior in any way, but they may reflect those specific contingencies that are affecting our observable actions. So I'll give you an example. So let's consider that you've been stuck in an elevator once. So one day you went into the elevator, you got stuck, and it might have elicited, specific feelings of fear. It might have caused some increased heart rate, some sweating. Maybe you felt nervous, different types of feelings that you could have experienced. But now every time that you approach an elevator, you feel anxious. In this case, we have to consider, well, what is the behavior and what is the feeling? We as radical behaviorists acknowledge that feelings exist, but we realize that feelings are just a byproduct of behavior. They're not the behavior itself. So in this particular example, the feeling is just being anxious, being nervous, whereas the behavior itself is walking into the elevator. Walking into the elevator, brought up these feelings, but it's not, the feeling itself is not a behavior. We can't define feeling anxious. We can't target that particular term, feeling anxious. That it's just a feeling. It's not something that we can quantify. It's something that's very difficult to explain in an objective way. It's something that's so subjective, and so we should never include feelings in our definitions. So no, feelings are not a form of behavior. They are private events, and they cannot be directly observed or measured by others. So instead of targeting feelings, which, like I mentioned, they're not a form of behavior, so you should never include that in your target definition for behavior. We will instead focus on observable behaviors and those different environmental variables that are going to be influencing them. So instead of targeting the behavior of feeling anxious, as a behavior analyst, I would instead focus on those observable behaviors that surround that feeling. So what is that? What are those avoidance behaviors? Is it running away? Or is it, scrunching of the face and maybe pulling the body away? Is there anything else that's observable and measurable that is related to that context of that behavior? And then what I would do is I would try to manipulate the antecedents and the consequences in order to reduce those avoidance behaviors. So we don't target feelings, but we can target specific behaviors that are related to those feelings. I can work on desensitizing a person to an elevator and make it so that they that experience of approaching an elevator is no longer paired with getting stuck in the elevator. And so in the future, when they go into an elevator, they don't have that history anymore, right? The elevator is no longer being paired with getting stuck, but rather it's paired with reinforcement, being able to access new floors, new environments, new reinforcing areas. So now that we've gone over what may classify as a form of behavior or may not classify as a form of behavior, I want to give you guys some examples and non-examples of behavior, okay? So as I mentioned earlier, the different words that end in ing tend to be describing an action, and so they usually classify as behavior, okay? So some examples included here are raising a hand in class, eating a meal, writing an essay, and laughing at a joke are all forms of behavior. There are some exceptions to this, like laying down. Laying down is not necessarily a form of behavior. because a dead man can do that. I don't know if you've ever heard of the dead man test, but the dead man test says basically that if a dead man can do it, then it's not a form of behavior. And laying down is something that a dead man can do. And so you want to be very cautious when you are attempting to define a behavior, that you are defining it in a way that is consistent with an action. Okay, so laying down is not necessarily an action unless you're engaging in that behavior of laying down. But if you're already in a position where you're lying down, then that doesn't necessarily classify. Okay. And then some non-examples of behavior are the different emotions that I described, or the feelings that I described: being happy, being sad. Those are private events that we experience. Having a stomach ache is not a form of behavior. Those are, again, feelings. And there's specific stimuli that we feel and that can influence our behavior, but they're not behavior itself. And then thinking, I put thinking under this category, okay? Thinking is, like I said, it's a form of behavior, but we as behavior analysts, in most cases, tend to focus on the effects, on studying the effects indirectly, and we focus on those observable behaviors that are related to thinking. So yeah, just, I just want to clarify that because I did include it here, but I did mention earlier that thinking, according to the radical behaviorist, is a form of behavior. Okay, so the first one that we will be reviewing is crying. And now crying has that ing, and this one does pass the behavior test. It does pass the dead man test, and we would just have to define that behavior very clearly. Now, what about having a stomach ache? As I mentioned in the previous slide, this does not pass the test. So having a stomach ache is a stimulus that we experience that may influence our behavior. You can have a headache, right? It's a feeling, but it's not a behavior in itself. Okay, this will influence, so these are like antecedents. These are antecedents that may influence our behavior. I mean, it doesn't have to be an antecedent specifically, but it can be considered an antecedent in an example of like taking medication. So if you have a stomach ache, you may go take medication to relieve that particular feeling that you are experiencing. Next, we have a tantrum. A tantrum does pass the behavior test and can involve many different topographies of behavior. Walking, again, it has the ing. Tantrum does not have the ing. It can, tantruming, but it is an action. So that's why it passes the behavior test, or the dead man test. So it is a form of behavior. Losing weight. Losing weight is not a form of behavior, but it is a permanent product. You can engage in other behaviors that may result in you losing weight. And sometimes we do measure permanent products in behavior analysis. So, for example, I might measure completion of a worksheet as a behavior. You can engage in other behaviors such as exercising that will result in losing weight, but losing weight itself is not a behavior. So this is not a behavior. Exercising is a form of behavior. It's an action. Whoops, I should have put that over here. Feeling anxious, as I mentioned, it has the ing, feeling, right? But it doesn't classify as behavior. So it's just a byproduct of behavior. And then rolling your eyes is a form of behavior. This is an action that we engage in. Okay. Okay, so now that you have a better understanding of what behavior is, let's work on defining behavior. First, let's get started with talking about why it's important to have a very well-written definition of target behaviors when we are going through that behavioral assessment process. So Remember, when you are defining a target behavior, you can expect for your therapists or researchers to be looking at this behavioral definition and using this behavioral definition to count instances of a behavior. And if you have a very clear and well-written definition of your target behavior, then the different researchers or the different observers or therapists will be able to collect data on the exact same instance of behavior, right? You're going to have consistency across the different observers or the different researchers. And consistent data collection is necessary so that you can make an analysis about the effects of the intervention on your behavior. If you don't have an accurate or a reliable way to measure your behavior, then how can you possibly interpret the data that you have available to you to determine the effectiveness of that intervention? Okay. Also, having an accurate or a good quality behavioral definition is going to make it so that caregivers, your therapists, staff, teachers will be able to implement the specific interventions with more ease, because they know exactly when the behavior is occurring and when the behavior is not occurring. If you have, like, let's say a definition of behavior that's not very clear or is very ambiguous, the therapist or the caregiver or the teacher might miss an opportunity to intervene on a behavior because they weren't sure if that counted as an instance of behavior or not. And so, being able to be on the same, having a clear definition of behavior allows you to be on the same page with everybody about when to intervene on a particular behavior and when to track that behavior. A good target behavior definition also improves the validity of a behavioral measurement. And validity is basically the accuracy of what we are measuring. It ensures that we are measuring what we are intending to measure and not something else. If you don't have a clear definition of behavior, someone might inadvertently track an instance of the behavior, thinking that the behavior occurred because, again, we had an unclear definition. And so then our data is not accurate and isn't reflecting what we want it to reflect. And so we might have a great intervention that we spent so much time developing, but our definition is poorly written, and so we can't look at the data to see the effects of the intervention. So it makes it very difficult for us to track progress. So now let's look at how we can define a behavior and what exactly what components are necessary within a good quality behavioral definition. So when we are defining target behaviors as behavior analysts, we need to make sure that our behavior meets specific criteria, or our behavioral definitions, meet specific criteria. First, we want to make sure that our definitions are going to be very clear, complete, very accurate, and concise, so that all the different observers that are going to be collecting data on that particular behavior know exactly what they're supposed to be collecting data on without any question or without any ambiguity. And so when we define our behaviors, there are 3 characteristics that our definitions should have. Our definitions should be objective, written in an objective manner, meaning that we only use observable terms or describe the behavior based off of the observable characteristics of that behavior. And also we can include information about the environment if it's necessary. So first, it has to be objective. Next, our definition should be clear, which means that our definitions should be very objective and free from ambiguity, subjectivity, and that it should be something that multiple observers can read and understand. And then finally, our definition should be complete. And for a behavioral definition to be complete, there are certain components that need to be included, such as when the behavior starts, information about when the behavior starts, when the behavior stops, what counts as a specific instance of the behavior and what does not count as a specific instance of the behavior. Okay, so these 3 things, an objective definition, a clear definition, and a complete definition, are going to make for a really good quality behavioral definition. when we construct target behavior definitions, we need to also consider functional information about the behavior and also topography. Okay, so I want to take a moment really quick to review some of those different characteristics that I've mentioned throughout our presentation today that you should exclude from your definitions or should not be included in your definitions. I've mentioned throughout the presentation today that our definitions should be as objective as possible. That means that they should be free from ambiguous or subjective terms. Okay, so we'll start off here. So what does that mean? That means using terms that can mean different things for different people, and it can be difficult to quantify what they mean. So terms like loud, for example, loud will mean loud or far, bothersome, annoying. All of those things will be different depending on who is observing the behavior, who's collecting data on the behavior. What's annoying to one person may not be annoying to another. What is loud to one person may not be loud for another person. And similarly, distance can far, right? What is far for me will be different for what another person perceives as being far. And so when we include subjective terms in our definition or ambiguous terms in our definition, it makes it very difficult for multiple observers to collect accurate data on the same behavior. And also, for the intervention to be implemented consistently. So then we should also avoid including mentalistic terms in our definition. And mentalistic terms is referring to internal states or to feelings, for example. So don't include anything that makes mention of feeling nervous, feeling anxious. Sally throws a tantrum because she's nervous. That's not an observable or a measurable way to define a behavior, and so we shouldn't be including that in our definition. And then finally, you want to avoid using unobservable terms in your target behavior definitions. Unobservable terms are terms like want, which refers to intent. We never refer to intent when we are defining our target behavior. Want, trying or seeking, refusing, all of these different types of terms are referring to just intent, what a person may intend to be doing when they're engaging in a behavior. But we don't know that. We're making an inference about something, and it can be difficult for different observers to collect data on that same thing. And so it's something unobservable. It's something that we're making a presumption about, right? We're presuming that may be what that person feels or is wanting to do. And so that's why we avoid defining behavior by explaining desires or what a person is attempting to do when they're engaging in a behavior. Because we don't know what a person is attempting to do, but we can look at consequences. We can look at the effect that a behavior is producing. That is something that is observable. But desire, want, is trying to, is seeking. All of those are terms that just refer to an implied state that a person may be experiencing. And so we shouldn't include those in our definition, because it would be very difficult for multiple observers to collect data on the same thing when we use terms like that. So let's continue our discussion on what to include in our behavioral definitions. So we need to make sure that our target behavior definitions are measurable. And so how can we expect to measure our behavior? In order to make our behavior definitions more measurable, we need to consider what dimension of the behavior is important to us. You haven't, at this point, you've learned about a few dimensions of behavior, but you haven't been exposed to all of them just yet. And you'll learn about these in a future course, but I'll give you a brief introduction here, and you may have talked about some of these in your introduction to experimental analysis of behavior course. So there are different ways to measure behavior. We can measure the frequency of a behavior, which is how many times a behavior happened in a particular period. So let's say that the behavior occurred 3 times, well, the frequency would be 3 times. We can measure the duration of a behavior, which is how long the behavior happens from beginning to end. How long the behavior lasts from beginning to end. There's typically a onset period and an offset period that we can track. Then we can also look at rate. Rate is the number of times that a behavior occurs across a specific unit of time. So we can look at, for example, instances of aggression, the rate of aggression per hour. Okay, so how many times did the aggression occur in each hour on average? We can also look at latency, which is the time between an antecedent and the behavior, or when a stimulus is presented and a behavior starts occurring. So a quick example of this is you ask a quick question. Let's say that you say, how old are you? And then how long it takes that person to respond. So latency is just the measurement of time from when a stimulus is presented to when a behavior occurs. Then we can also measure intensity. Intensity is how intense a behavior is rated on a particular scale. We can look at rating scales. There are more objective forms to measure intensity. Like you can, if you are trying to change voice volume, for example, you can measure. So you can measure using, for example, decibel, like a decibel meter. If you are measuring the intensity of aggression, you can create like a scale where you define the specific, severity of a behavior. You can have a low intensity form of aggression, a moderate intensity, and a severe intensity. Maybe one results in bruising. Maybe another one results in something more, like some more damage, like, I don't know, a cut or bleeding, something more permanent. So there are different ways to just measure intensity in behavior analysis, and you'll learn about all these different forms of measurement in another course in a much more extensive manner. But I did want to expose you to the fact that when we're defining our behaviors, we want to make sure that we mention how we plan to measure that particular behavior. So next, we also want to make sure that our target behavior definitions include examples and non-examples of the behavior. An example basically helps us to identify what counts as an instance of the behavior. And then non-examples tell us what would not count as an instance of the behavior. So say, for example, if we're looking at the behavior of aggression, well, an example of aggression, you would have to specifically define what counts as an example of aggression. And then you would also define what counts as a non-example of aggression. So let's say, for example, that you have a client that participates in karate and they engage in hitting within that appropriate context. We wouldn't count that as aggression because it's not considered a form of problem behavior in that particular context. And so when you are defining your behavior, you want to make sure that you are explicit about your examples and your non-examples. In your examples, you're going to include exactly those situations, contexts, environmental variables in which the behavior should be counted. You're basically explicitly saying this, under these contexts, you should count this as an instance of the behavior. And then when you're defining your non-examples, you're basically saying these do not count as an instance of the behavior. So even if it meets the definition, if it's under this context, please don't count it, because it might not be considered a form of problem behavior or whatever it might be. It just doesn't meet the definition for whatever reason, it might be. So you want to be very explicit about what does count and does not count as an instance of the behavior. And the reason for this is because you want to, again, make your definition as clear as possible, as objective as possible. You don't want people to have to guess what counts as an instance of behavior or does not, right? You want everybody to be on the same page. You don't want things to be ambiguous. you want your observers to see an instance of the behavior, immediately know this, I need to track this, I need to collect data on this particular behavior, and I also need to intervene on this because this was an instance of the behavior. We also don't want people implementing an intervention for something that wasn't an instance of problem behavior. So let's say that I have a client that I'm working with, like I said, on managing their aggression, on reducing their aggression, and then I accompany them to their karate class, and they are engaging in appropriate forms of hitting because it's what is expected of them in that class. And then my behavior definition doesn't include karate as a non-example. I should track that according to my definition as an instance of aggression, and I should also be implementing my intervention. But that's not correct, right? That's counterproductive to what we are trying to achieve with the intervention in this context. And so you as a behavior analyst have a responsibility to be as clear as possible with your definition. So now that you've gotten a breakdown of the different components that are necessary for a behavioral definition, I want to put it all for you on one slide so that you can see exactly what you need to be working on when you're defining a target behavior. And the first thing is to come up with a behavior label. Again, make sure that you're using observable terms. You're trying to list an action rather than a lack of action. We talked about that earlier. So select your behavior label, and then whatever your behavior label is, obviously it's important, but it doesn't matter as much as your behavioral definition. Okay, so the behavioral definition is where you should focus the majority of your attention. Like I said, you want to use your observable and measurable terms, right? How are you planning on measuring that particular behavior? So for example, if you're going to collect frequency data, then you want to say in your definition, you may mention each instance in which a behavior, blah, 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 each instance in which, and then you define your behavior. Or if you're going to collect data on duration, you want to mention in your definition when they should start recording the behavior and when they should stop recording the behavior. So you would say an episode of a tantrum begins when X, Y, and Z behavior is displayed and stops after 3 seconds of no crying. So you want to have like an exit criteria or a stop criteria so that the observer knows when to stop collecting data on that particular behavior, and also when to start collecting data again on the behavior. So you need to have a clear onset and offset behavior. That's what we call it. Criteria, I'm sorry. You don't want to include the behavior label in the definition. I'm going to highlight these because these are really important. Do not include the behavioral label in the definition of the behavior. Oftentimes, I see definitions from students, okay, where they're attempting to define, let's say, eating. You're just trying to define the behavior of eating, and they say each instance in which Jimmy eats something, and that's not, you did not define the behavior with observable and measurable terms. You just used the behavior label in the definition itself. So please do not include the label of the behavior in your definition. You should be clearly defining what does eating mean. It can be each instance in which Jimmy opens his mouth, inserts food into his mouth, moves his jaw up and down in a biting motion, and then moves that food to the back of his mouth and swallows the food. That counts as an instance of eating. So do you see how, you can imagine how much clearer that definition is. My definition involved placing the food in the mouth, chewing the food, and it also involved swallowing of the food. Okay, so that my observers know it doesn't count as an instance of eating unless the behavior of swallowing occurred. Okay, another one that's very important is do not include the antecedents in the definition of the behavior. And the reason that we don't include the antecedents in the definition of the behavior is because by including the definition, you are lending yourself to talk about intent, which I talked earlier about not including intent. When we try to define behavior in terms of the antecedents, we typically will end up saying that like for example, Jimmy engaged in aggression because he wanted attention. Okay, Jimmy's mom was not paying attention to him, and so he engaged in aggression because he wanted attention. And it's just it ends up making it so that your definition is not as objective, and you're not using observable terms. So please don't include the antecedent in the definition of the behavior. Crying versus crying when mom yells. It's crying. The important behavior here is crying. Is crying going to be problematic only when mom yells? That's why also so this is an example. Sorry, I didn't clarify that. This is an example of not including antecedents in the definition of behavior. So we should be saying crying versus crying when mom yells, because what happens when crying occurs under another context, right? There was another antecedent that preceded it. Does that mean that you won't count the definition? That you won't count the behavior? Because of the definition. The definition specifies that crying is only when mom yells. So what about if crying occurred because dad took away a toy? Would that not be considered, an instance of problem behavior? Or what if crying is occurring because demand was just placed? So we need to try to exclude antecedents from the definition of behavior as much as possible. Okay. And then we also, this one is very important, and I find that it's also very difficult, which is that we need to make sure we're capturing all of the different responses that are in a response class. This one in particular is difficult because sometimes we don't know the function of a behavior. And when we don't know the function of a behavior, it's also sometimes difficult to know what all of the responses in the response class are. And so you want to do your best to identify all of the different responses in a response class, but it can be very tricky. And sometimes it's better to define behaviors in terms of their function so that you can capture all of the responses in the response class. I have an example in a later slide that will help clarify what I mean by this. But I can give an example here as well. When a child engages in a tantrum can look completely different for every single child, right? A tantrum for one child may be screaming and throwing themselves on the floor, whereas a tantrum for another child may be screaming, throwing themselves on the floor, crying, throwing of objects, banging, property destruction, banging on doors. It can involve so many things. So if I don't know all of the responses that occur for the same function, right, that let's say they're all occurring for escape from demands. If I don't know all of the different topographies that are embedded or included in a tantrum for a particular client, and I try to define a behavior in terms of the different topographies, if I end up excluding one, either by accident or because I didn't know it was part of the same response class, a therapist may not intervene on the behavior. And by not intervening on the behavior, that behavior may contact reinforcement, and so then it'll be very difficult for us to effectively reduce the behavior. It'll make our intervention less effective. So that really is the main reason why we want to make sure that whenever possible, we are including all of the different responses from a response class in a definition, so that when we're intervening on all of those different topographies and not just on the ones that are specified in the definition. Okay. And then the last two components are that we should include examples and non-examples of the behavior, which we covered previously. I gave you guys some examples already, but I just want to add a slide for it. You can start your definitions by saying some of these terms or some of these phrases, I'm sorry. So for example, it could be aggression is defined as, or aggression is each instance in which yada, 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 and then I would define my behavior. Or I could say, for example, I wouldn't say aggression is each episode, because episode implies that it's a behavior that occurs for a longer period of time, whereas aggression is typically one instance usually. So I could say, for example, a tantrum is defined as each episode in which, and then I would give my specific onset and offset criteria for when they should start recording the behavior and stop recording the behavior. And I would define what the behavior looks like, etc. Or I could say, let me think of another behavior. Pencil tapping refers to any instance in which, and then I would define my behavior. All right, so now that I've gone over the different components of a target behavior definition, what to include, what not to include, etc., let's go over a sample behavioral definition, and this is going to include all of the necessary components. So I'm going to define the behavior of throwing or swiping. That's my behavior label. Okay, so here's my behavior label, which you want to make sure to include. Sometimes when I'm reviewing student assignments, I see that you forget to include a behavior label. Please make sure you're including a behavior label. Okay, so throwing or swiping is defined as each instance in which Blanca launches an item, which is not meant to be thrown, 1 or more feet from her. And this obviously can be subjective, so I did my best to define that in the examples and non-examples. So an example includes throwing a piece of paper greater than 1 foot. An example can also include pushing a phone off a table and it landing greater than 1 foot away. This is not going to be exclusive to these examples, but these are just ideas of what may be included in the behavior. Instead of a piece of paper, maybe it's an eraser, right? Maybe Blanca threw an eraser. That's fine, but these are just examples, general ideas. And I also specified in my definition that it's items that are not meant to be thrown. And then some non-examples include throwing a ball at the basketball hoop, throwing trash in the bin, throwing items that are meant to be thrown in the context of a game. Okay, so my non-examples include the context under which the behavior should not be counted. Okay, so which all of these examples that I've provided are examples in which basically throwing is okay. So I want to make sure that I define that so that when someone is reading my behavior definition, it is clear to them exactly when they should count an instance of behavior and when they should not be counting an instance of behavior. Now that you've gotten a general sense for the different components to include in a behavioral definition, I want to review the 2 types of behavioral definitions that exist. Okay, so in behavior analysis, we have function-based definitions, and then we have topography-based definitions. Topography-based definitions are going to be those definitions that focus on the form of the behavior, or they define the behavior in terms of what it looks like, whereas the function-based definitions are going to define behaviors in terms of it's the behavior's effect that's produced in the environment. Okay, so as I just mentioned, when we're defining a behavior using a function-based definition, we are defining that behavior in terms of its effect on the environment, or basically the function or the outcome that was produced by the behavior. Okay, so an example of this could be defining, like for example, I could define hand mouthing as each instance in which Jimmy puts his finger in his mouth, wiggles it around his tongue, and then takes it out. I could also define it as each instance in which Jimmy places his back of his hand in his mouth. And I could try to define all of the different topographies that encompass this behavior, or I could define it using a function-based definition, which is much simpler and will help me capture all of the different responses in the response class, which is what I was telling you guys about earlier. Okay, so an example of this would be to define hand mouthing as any behavior that results in contact of the fingers, hands, or wrist with the mouth, lips, or tongue. So I'm specifying it could be any part of my hand, any part of my fingers, or any part of my wrist touching my mouth, my lips, or my tongue. I don't have to worry about thinking of all of the possibilities of topographies of this behavior, because this function-based definition is including all of those topographies. And so when my a therapist goes to observe the behavior, I can know that with a high degree of confidence, they're going to count the different forms of the behavior, because we are, instead of focusing on form, we are focused on the result. Any behavior that results in the contact of the fingers, hands, or wrist with the mouth, lips, or tongue. Pretty much everything is captured in that definition. Okay. These types of definitions, function-based definitions, often tend to be simpler and more concise than topography-based definitions. And whenever possible, we try to define our behaviors using function-based definitions, but we don't always know the functions of behavior. And this makes it very difficult to use, obviously, a function-based definition. So we then do rely on topography-based definitions. But really, the best way to define a behavior is to use a combination of the two. So we'll go over what a topography-based definition looks like now. So as I mentioned, a topography-based definition is a definition that focuses on the form of the shape of a behavior. So this could be like the example that I gave you guys earlier, where I was trying to define hand mouthing using the different forms of the behavior. So I said, sticking your finger in your mouth and wiggling it around your tongue. Or I could say placing the back of the hand on the lips. That could count as an instance of hand mouthing. Or I could say placing your palm directly over your mouth. That could also count as an instance of hand mouthing. And so when we are using topography-based definitions, we are simply describing exactly what the behavior looks like, and we try to be very specific when using topography-based definitions, so that it's as clear as possible to the observer what is included. And these types of definitions should be used primarily when we don't have that direct, reliable, or easy access to that function of the behavior, or when we can't rely on the function of the behavior. Okay, so now let's look at an example of the difference between using a function-based definition versus a topography-based definition, okay? So I want you to pretend that you are trying to define the behavior of opening doors, okay? A simple behavior, an adaptive behavior. Would you define the behavior using all of the different topographical forms of the behavior, or would you define the behavior based on the function? And I want you to think about what each of those definitions would look like also. So let's pretend that we are going to define the behavior of opening doors using a topographical based definition. So let's look at all the different forms of the behavior. Okay, we can open a door by pushing the push to open button. We can open the door by pulling down on the handle, right? And let's say that's this type of handle. We can open a door by turning a knob. We can open a door by using our elbows. I've used even my hips when I open the door. Or even now after COVID, I've seen these a lot more. You can open the door by using your foot, right? There's so many different ways to open a door. And if we were to use a topography-based definition, we would need to capture as many of the different topographies as possible. Otherwise, if we don't include a specific topography in our definition, then it should not be counted by an observer. So say, for example, that I missed a particular topography like my hips, opening the door with my hips, which I have done on many occasions, then that would not be counted towards that particular definition, that particular behavior. So let's try defining the behavior topographically. Let's see what it would look like. So the behavior of door opening would be defined as each instance in which an individual uses their elbow, foot, or hand to interact with the door or its mechanisms, and they apply enough force to move the door on its hinges to create an open space. And this includes pressing an automatic door button, pushing or pulling a handle, or twisting a knob with enough force to open the door. So this definition works, but it's super long. And the problem is, like I mentioned, it doesn't capture all those different responses that are included in that response class, okay? Remember, the response class are all those different groups of responses that achieve that same effect or have the same function, serve the same function. So for behaviors like this, like I mentioned, it's best to define the behavior in terms of the effect that they produce on the environment, which would mean that we should use a function-based definition. So I want you to practice how you would define door opening using a function-based definition. Please take a moment to respond to that. Okay, now that you've taken a moment to respond to how you would define door opening, I'm going to give you my sample definition for door opening. If I were to define door opening, I would define it as any action that results in the door moving from a closed position to an open position and that allows access to a new area or a new space. It's a much shorter and much simpler definition that focuses on the effect that the behavior produces on the environment. We move the door from an open position to a closed from a closed position to an open position, and now we are able to move through the door. Basically, we can access a new area or a new space. Much simpler. It encompasses all of the different topographies. I don't have to worry about whether I included or excluded a particular topography, or whether an instance of the behavior is gonna be missed because of my definition. Okay, and here is that particular definition that I just mentioned. This definition is simple, it's comprehensive, and like I said, it captures all of the different topographies in the response class. Oh, and this is a good point that I did not mention. But if one or more of the behaviors within a response class are excluded, those behaviors may continue to occur and potentially be reinforced by the environmental contingencies. And the reason that it may continue to occur is because if it's not included in the definition, you won't be targeting it. You won't be intervening on the behavior. And so, of course, that means that the behavior will end up being reinforced. And when one topography in a response class is reinforced, the behavior is going to continue to occur because they all serve the same function. Because you basically will be extinguishing potentially if you're implementing extinction or not. It depends on your intervention. But anyways, whatever intervention you're implementing, you will be intermittently reinforcing those definitions that were those topographies that were excluded from your behavioral definition. So let's review. Please take a few moments to respond to these questions, okay? So what are the two ways that we have discussed in today's lecture to define behavior? Okay, and now I also want you to take a moment to name the 4 necessary components to include in an operational definition of behavior. And that is it for our lecture on defining target behaviors. I hope that this helps you with defining target behaviors in the future and completing the upcoming activity on defining behaviors.